So it's Monday. Yes, it's Monday. I'm losing track of days. Monday, the 23rd of March, 2020. And it's day 12 of my self isolation. And it's been 7 days since I had any symptoms, and 5 days since I was tested for COVID-19 at the test centre here in Los Angeles. Yesterday, I got my results back for COVID-19 and they were negative. Today I got a phone call from the test centre and a follow-up email. My flu virus test, which they also ran, came back negative. And if you've been watching my videos, you'll know that my business partner Scotty had the same results, negative for both COVID-19 and flu. But he subsequently ended up in hospital on a ventilator. However, we do know that at that point the tests were unreliable. So I've been asked to continue to monitor my symptoms, not just because there has been cases of false negatives, but also because this virus can incubate in a person up to 14 days, meaning that it can take 14 days to actually test positive or develop. So technically I've got another 7 days before I'm completely in the all clear, which I'm fine to. I mean, it's another waiting game, but I'm not going anywhere anytime soon because this thing is escalating and it's going to take several months at the least for it to calm down or peak, as they say. I mean, I think it's going to be a long time before we really know the true virility of this virus. I think we're going to have to look back on it with a distant memory before we really have all the data. There's so much unknowns, right? We all know that. We're all getting so much confusing information. But some data is trickling through, and it's now known that the young are not spared. And in fact, there's a significant number of people in America under the age of 50 requiring hospitalization for coronavirus. So don't just think it's the elderly, it's every age range from 20 upwards. It's almost like the virus kind of has this secondary stealth move that, attack the old people, blindside the young people. And we need to be aware of that. We need to communicate that. It's not just the elderly, it's everybody. And let's not forget about all the nursing staff out there who are trying to help people and save their lives, and they have no protective gear. I mean, it's shocking that we are in this day and age. We have a shortage of protective gear for nurses and doctors. I mean, it's heartbreaking. Just think about them for a minute. Yesterday, I was very pleased to be able to tell my son that I tested negative because he is in the US Navy and he didn't want to be able to give his superiors the news that I was positive, because we actually hugged each other within the past 12 days. I couldn't resist hugging him when I took him some hand sanitizer. I didn't want to just throw it over the parking lot. But this morning he called me to say that somebody in the floor above him where he's studying for his next orders tested positive. So my son seems to think he's either going to get it, if not now, very soon. But he's young, healthy and strong, so I'm not overtly concerned about him. Fingers crossed. And news from my homeland in Scotland. Finally, Nicola Sturgeon, the First Minister, has locked down Scotland. Cases are up to 499 and the deaths are 14. But again, they're just starting to see the upsurge there. I'm really happy that she's done that. I think it's a really good move, because I've got family there that I care about. My brother works in public transport. He's got asthma and he went back to work today after being on vacation for a week. I got a phone call from my childhood friend Linda, who I love to bits. She's a sweetheart and she works in a hotel in the heart of Glasgow. But Linda has underlying conditions, COPD, and she also smokes. She has been told by her bosses that she can continue to go to work. It's up to you, Linda, but if you decide to stay off work, then we're not paying you. Oh, and by the way, we're going to cut your pay to half pay. So I spent an hour on the phone with her, pleading with her not to go to work and explaining that, you know, your bills will still be there. The government have got to do a lot more. They dropped the ball. Don't worry. Your health is more important. And just contact the social services and get on benefits and tell them your situation. At least that's the one good thing about the UK. There's a benefit system and they have the NHS. It's way more supportive than it is here in America. I was just watching the TV this morning, a news report about an actor who was struggling to get tested for COVID-19. Funnily enough, when he was coughing, it sounded a lot like my cough. Anyway, he finally got into hospital. He didn't get tested, but they still slapped him with a $9,000 bill. The National Guard are now being deployed and being mobilised to come out to certain places in America. I think California is going to follow New York and Washington. Again, it's inevitable. I thought that was going to happen, and it really needs to happen, because even though Angelenos are being great at responding to this health crisis and all the advice that our governor is putting out, there's still hundreds of people flocking to the beach. Too many people too close together. I heard on KCRW today that there was a comment made about people at the beach in Newport, where Scotty lives, being interviewed and saying, oh, we're not going to let the coronavirus change the way we live. I mean, come on, guys, this is science. This is, you can't just avoid the virus. It's gonna get to you one way or another. So do the right thing. Stay home. It's going to be too little too late if we don't all get together. We're in this together. And as I've been telling all my friends and family, if you want to know what to do now, think about what they were telling us to do 2 weeks ago. Right? Locking down Scotland. Where do you think we're going to be in 2 weeks from now? The National Guard are coming in. Where are we going to be in 2 weeks from now in California? So, please, stay strong, stay united, and stay home. We owe it to each other. And that's enough for me today. I'm going to speak to you later on. But right now, I'm going to go and, I don't know, lie on the deck and get some vitamin D, because apparently that's really good. See you later.